It's a war against a common enemy, the novel coronavirus, COVID-19. All institutions, health professionals are putting in their efforts to ensure that we're able to combat this particular virus that has brought life to a standstill. In Ghana, one particular group of people who are helping in this fight is the National Ambulance Service. They have an untold story. And in the Citi Newsroom today, we are here to find out what they do. They've set up at the Accra Sports Stadium with a COVID-19 team. So join us on the Citi Newsroom as we engage some of them to understand what exactly they do.
As transport team and as National Ambulance Service and organization, we serve as a bridge between the community and the hospital. So before we receive any case is being sent to the hospital, we serve as the link. And as we move these cases, we also provide the needed care and support for the patient before the patient gets to the treatment center.
Can you tell us how many cases you've transported so far?
Currently, as at yesterday evening, we've transported over 1,500 cases, that is nationwide. And Accra has transported almost 1,000 cases out of the 1,005, which is over 60% of the cases transported.
Well, so I want you to take us around and show us what happens on a daily basis when officials and personnel report to the center.
Okay. Basically, what we do in the morning is we have a dedicated team, as I said. So we all assemble here and we find out from them. We do debriefing, something we call debriefing. So we find out from them in the course of their duty the previous day, what happened, the challenges that they raise when we talk with them. We try to also address those challenges before they even start the day's activity.
This car was used yesterday. So can you take us through what happened today with this particular car?
Okay, what happened is once the car is ready to move, after the disinfection has been done, we do what we call daily checking. We check all the equipment in the car and we check that we have adequate PPEs. So what we do is, since we are transporting COVID cases, we always try to minimize contamination of the PPEs that we use. So we separate the PPEs from where the patient is. That is, we put it here.
If I'm a personnel, what items should I take to be sure that I have everything intact?
We call something IPC, infection prevention control measures, and something you can't always do. You can't do away with it. So the first thing that you step out as an EMT to provide care is to make sure that you have all your PPEs in stock. So they come and do that checking to make sure the PPEs are readily available before they move. And also check the equipment. Check whether we have oxygen in the oxygen cylinder, your flow meter is working. You check, we have a patient monitor. We check that all these equipment are working. The trolley, that is one of the major equipment that we use. So you need to bring it out and push it in to make sure that the trolley is in good condition before you step out. You can see the ventilator. The ventilator too is here. So
you always have a ventilator in the ambulance?
We always have ventilator in the ambulance because we don't know the condition of the patient, and when the need arises for us to ventilate the patient, we are always ready to do that.
We've checked all these things. Everything is right. We are yet to get a call from the team suggesting that we have a case. What typically will be happening?
Okay. What we do is we receive in the morning, we receive a data of the cases that we need to attend. So what we do is we assemble and tell the team members that you are going to this location to go and pick a patient. When the calls come or when the data come, they send it through WhatsApp to us. So what we do is we check the patient contact. We call the patient to tell him that we've been dispatched to come to your residence for you to be moved to the treatment center.
So this is your workstation. So when you get a call, even before you move out, you have to make sure that some protocols are observed right here.
This is the app we are using as a service. So if there is a call, if a call comes and the patient does not use the Ghana Post GPS, and we get the patient details and the exact location of the patient, this is the interface. So you come to what we call the district. Then you see add new district. So I'll come here and enter add new district. Okay, so I have to key in the patient's name. Then why the call? Transport of suspected COVID case. So I'll just come here and click on submit. So it will send the information onto this tablet. So I'll look for the nearest ambulance from here. You see all these ambulances are active. That means they are ready on the ground to move to any emergency. So I'll look for the closest ambulance here. Okay, 649 is active. So now I'm going to dispatch the ambulance. So I'll just come here and click on what? Dispatch. So the ambulance is here. That is my location. So the ambulance will move. So you can hear. So the team moving, I've sent a distress to them. So they need to accept the distress. Then they will navigate their way to the patient residence.
Now you've sent the distress to the team. We want to speak to some of the team members. When they get a distress like this, how do they feel? Though eager as a team to carry out their activities, accepting to take up the challenge months ago was a difficult one.
The first day I was called to join the national COVID team, I remember I was so furious. I was like, why me? And then
You thought it was a punishment?
I thought it was a punishment. Seriously, I was so furious. I was so angry that day. I think I wept when I went back home.
Wow.
I did.
They have had to deal with stigmatization and attacks from relatives of persons infected with COVID-19.
Went to Esuchari to pick some cases. So after picking the patient, who is about 76 years, driving off to go and pick another patient, the son brought someone on a motorbike to come and intercept us. So we stopped and then asked what the problem was. And then he was like, whom did we ask permission from before taking the father? So upon talking about it, we realized that our lives were at stake, and then we had to release the man to the son so that he will allow us to go. So we released the father because the son was actually threatening us that he has a team, that if we don't allow the father to go, he will bring his people to come and fight us. And we are EMTs, we don't carry guns. So if somebody confronts you like that and like, we have to take our father, you don't have anything to do than to say, okay, take your. And then I must say that that day was one of the most difficult days because we've been going for cases for almost 3 months now, and then encountering something like that, it really shook us because it was just me and then my other colleague who is the EMT driver. So, and then the community, the disease control guys, they are also not having guns or they don't have anything to protect us. So it was just us and then the disease control guys, and then we had to surrender and give the patient back to the family.